All right, so we're going to talk about next-gen interoperability today. So what I like to do when I have this conversation, I like to put a couple points onto PowerPoint just so we can level set exactly what is next-gen interoperability. As Wendy mentioned, we're going to be focusing on our ability to integrate or pull information via care quality, but also that direct messaging that's going to drive your referral base as well. So let's go ahead and look at some of the components that are tied to that area within NextGen under the interoperability platform. So just to have a full understanding is what is NextGen interoperability? Well, our connected health solutions are designed to exchange clinical data within hospitals or ambulatory EHRs and so forth across the nation and so forth. I like this little quote here: think globally and act locally, with data sharing services that work equally well whether you're exchanging data with local hospitals or providers across the country, which basically means with the NextGen, you have the utilities to tap into other EHRs to pull that discrete data back into your system and review that information and reconcile it into NextGen. So NextGen, allows us to connect into your local or national data exchanges, and that's driven through NextGen Share. So I can do a point-to-point connection to the hospital down the street, or I can actually reach out to a healthcare provider in Florida from my location to see if there's any documents or CCDAs I can pull into my patient's chart. Now, we'll do a nightly search of care quality, and all that is just a engine for health information exchanges where we can locate documents for a patient, and we then have the tools to import that immediately into the patient's chart. So your clinicians, when they launch into that patient's chart for the first time, they can review that CCDA or transition of care document and reconcile it into NextGen. So again, we do all the heavy lifting for you. You just tell us what time you want us to actually look through the health information exchanges powered by care quality, and then we have the ability to download the information directly into the patient's chart so your clinicians can review it and then reconcile it. Now, we do support the importing of a CCDA. That is really what is part of this interoperability platform. However, we also have the ability to import other documents such as op reports or discharge summaries, as well as diagnostic imaging reports. So when we ping that healthcare facility or that ambulatory EHR, or one of the very large national healthcare exchanges, we have the ability to identify these different document types and then bring them back into our system. Now, another component of our interoperability platform is NextGen Share direct messaging. Now, direct messaging in the simplest format is clinical email. It's an encrypted mechanism to provide electronic communications between providers as well as care team members. Now, when you onboard with NextGen, you can be enrolled in the NextGen HISP, Health Information Service Provider Directory. But there's other HISPs such as Allina Health, Epic, Cerner. They all enroll their providers into these HISPs. That is just basically an address book of all providers that have dedicated accounts for this secure and encrypted mechanism for having communications. So again, once this is defined, then we have the ability to send out a referral. If we want to send out any documentation via direct messaging, here are the three components that we can support. One is structured longitudinal CCDA documents. So for example, we can pick up the patient's chart, medications, social history, family history, allergies. If we pull down their lab results or any diagnostic imaging or implants that are charted with the NextGen, we have the ability to automatically send that outbound to a provider that we're referring our patient to. So then they can review that information and download it into their system. So they start off exactly where the patient left off within our practice. So we send that structured longitudinal CCDA document with our referral through direct messaging. Now, when I create the referral, I also have the ability to attach any encounter level documents. So if our system had a generated referral letter, we can attach that to the referral, any intake notes, an APSO document, the chart note. We have that capability. And on a direct message, just like an email, I can also attach, patient images. So if we're using NextGen Mobile, taking a photograph of a patient or an injury, that image can be uploaded and attached to that referral, or if there's any diagnostic results. or images. If they're uploaded into the patient's chart, I can take those and attach that to the referral. So these are the different document types we support within direct messaging, and I'll show you that in the demonstration today. Now, what are the other features that are supported through NG Share direct messaging? Well, you have a provider directory. It's 2.5 million providers that we can reach out to through this shared directory. All these providers have health information service provider accounts. Again, just like NextGen, any NextGen provider is going to be enrolled in a health information service provider account. So very easy for you to look up those providers. You can search by a provider by an MPI or the city, the state, and so forth. So again, it gives you that ability to look through an address book of these providers that have direct messaging accounts and then sending that electronic referral to them. When we send the referral over, we can create a referral package, but we'll also create that CCDA that sends that along with the patient documents and a referral cover letter. I'll show you that today. So this is all electronic. And then, of course, we use direct protocols to transmit new referrals. It's MU2 compliant for interoperability requirements. And you know what? We do sort and store when a message is delivered via NextGen Share within our system under the patient's PHI log. So again, we can see it was delivered and what time it was delivered and to whom it was delivered. So I just like to have a little quick overview of the different components that we support, either via interoperability, looking at NextGen Share and care quality of just sharing that CCDA, as well as direct messaging that really supports that referral protocol within your organization without having to print all this information and faxing it. Let's look at NextGen and allowing us to send that information out electronically. Again, saving time for your referral coordinators and so forth. They can own it here within the system. All right, let's go ahead and take a look at some of the components I just spoke to. So I have Pedro Share opened in my EHR at this point in time. And one area that I want to focus your attention to is data share. Now under data share, you can see I have two here. If I open up the data share little button here, I can see that I have a few CCDAs that my system pulled through care quality. So again, as I mentioned, we can set up NextGen to automate a search of care quality, looking at the national health information exchanges, looking at your local health information exchanges. And if we identify a document on the patient, we can import it directly into this work queue. So your clinicians don't have to do anything. There is one caveat, however. If there's a patient that was admitted into the ED, let's say, for example, at 2:30 in the morning, and they presented into clinic at 10 o'clock in the morning, well, if the clinician needs to, they could do a search on demand as well as for that CCDA. So again, it really allows you a lot of flexibility to bring these CCDAs into the patient's chart. But again, we want to automate as much as possible. So at 2 o'clock in the morning, we want to do a demand search for all your patients scheduled for tomorrow, and we can pull down those CCDAs. So once that CCDA is brought into NextGen, what does it look like? So if I click on that CCDA, I'm brought into the HIE document viewer. And what we do is that we take the language from that third-party system. Let's say, for example, it was an Epic shop and the patient was triaged in the emergency department. Well, we take that Epic language and then we look at that language and then we normalize it into NextGen speak because it's all codified data. So we're all using the same code. So it's really easy for us to take a CCDA from Epic, Cerner, Allscripts, McKesson, and then we can convert it into NextGen language. And what happens is that I can come into this full view tab here and I can review everything from this CCDA or transition of care document. I can see my patient's name. I can go ahead and look at the performing provider. I can go ahead and look at the location where this care was performed. And then we do a real good job of deciphering a table of contents for you. We normalize the information into specific sections. So if I wanted to look at allergies and adverse reactions and alerts, I can tap there, and this is the information that was received from that third-party EHR. So I can see they have a shellfish allergy, they have an allergy to ceftazoline, here are their reactions, here are the medications they're on. Now, this might have been medications that were documented as part of the triage, or maybe the patient's being seen by another clinician or provider, 3 states away. This is what's on the patient's EHR. Again, it allows me to review that information, and then I can go ahead and look at problems, any procedures, any clinical notes that were entered into the patient's charts. Here's just a summary of all the labs that were performed on the patients and any narratives tied to those labs. So again, it gives me that visibility, but the value of this is once I review it, I can come under import. And when I tap on import, this is where the structured data, because it's all codified, is available for the clinicians to review it. And then anything with a green plus sign next to it, I can go ahead and confirm it and reconcile it into my patient's chart. So again, I can reach out across care quality through the health information exchanges. It's going to return back information to my organization where I can review it. And instead of having to ask the patient each and every time, what medications you're on, I can pull it from that clinical EHR, review it, and then I can confirm it into the patient's chart. And you have multiple tabs here. For example, medication allergies. Here are some allergies the patient has. Now, there are 3 listed here on the CCDA, but 2 of them, I can see I can add the ceftriaxone. I can see there's a little chain link here was already on the patient's chart. So it's not going to duplicate that ceftriaxone allergy because it's already matched because it's codified data. So it's only going to add the morphine and the shellfish. So you don't have to worry about duplicated records using this type of technology. It's automatically going to map to those specific codes within the system. But if I wanted to look at any problems the patient has, I could add that to the patient's chart, which would return back into the problems list. I could go ahead and look at their immunizations. I could import those into my chart. I can look at the last set of vital signs. This is really important because you might be providing care to a patient, and maybe they had a hypoglycemic episode over the weekends and they were admitted into the hospital. Well, now I can pull in those vital signs that were obtained through the ED and then reconcile those into my patient's chart so I don't miss a bleep. I can come over here and I can look at the graphing of patient vital signs. Even when they were admitted into the hospital, I can pull those down into my patient's chart as well. Here's family history, social history, again, and as well as lab results. So going back to that patient who may have had a hypoglycemic episode, I can pull those lab results in from that third-party system. So I have a true record of those lab results within my patient's lab profile. But if I wanted to hide imported lab results, I can certainly do that as well. So I can only see those results within my clinic. And then, of course, I can show those imported lab results from third-party systems. So again, it gives you that type of flexibility with this workflow as well. So this is how we represent or return back into NextGen what a CCDA would look like through NextGen Data Share. That allows us to reach out to care quality, a national health information exchange network, and then allowing us to search out patient CCDAs or transition to care documents, and then bringing those into NextGen. And if I'm going to just say it one more time, we can automate this process for you. We can even import the CCDA for you, and your clinicians can then reconcile that into your documentation. So again, a lot of this can be automated for you. All you need to do is review and then reconcile. So that's one component of a CCDA. I want to show you one other feature here is that I also have the ability to bring in other documents. So for example, let's say Pedro had a medial meniscus tear. And once the provider signed off on their operative note in the acute care setting in the surgery center there, I can actually pull that organization, and then I can also pull in through care quality the operative report for that patient. And much like I mentioned in the PowerPoint, I can bring in the operative report, I can bring in a transition of care document, I can go ahead and bring in a HMP, radiology documentation, results documentation. So again, I have access to all those different types of documentation. But as you can see here, I have different navigation paths. So now I can go ahead and look at the surgeon, I can go down and look at the date of surgery, the preoperative diagnosis, postoperative diagnosis. So everything from an operative report perspective that oftentimes we're having to acquire via fax, Well, now can we acquire it via our interoperability platform and place it in the patient's chart? And I can even route this to the provider in their PAQ, or I can route this to a referral desk or what have you, other resources within your organization so they can see these documents come in as well and manage and triage those appropriately. So this is just an example. Other than a CCDA for longitudinal data, I can also bring in operative reports, HMPs, and so forth. So again, giving you that ability to view this information. Now let's transition into the ability for us to send a referral using direct messaging. Now I've already charted on my patient here, and they have calculus of the kidney. So I want to do a referral to a urologist in my local community. So one of the things that you may have discovered this, but under more, I can go into referrals, and it's going to bring you into NextGen Share. Now, this is a template that's designed for us to create referrals, either external referrals or even internal referrals. But I have the ability to identify who I'm going to refer to, and it's just pretty straightforward. I'm going to do my specialty, my specialist name, and then I can tap on this little zigzag line. And this is allowing me to search that 2.5 million providers who all have direct trust accounts. So it's just like us creating an email. I want to find somebody within the organization. I can search on their names. Now, one thing I like to mention is that when you onboard with NextGen's NG Share, you might reach out to a provider across town who maybe uses another EHR. Basically, what you want to do is ask that provider organization to say, what's your direct message account, or what's your MPI number, or what have you, versus asking them, do you have NG Share? Because of course they're on a different ambulatory system. So again, if they have a direct message account, you should easily be able to find it through this directory lookup. So that's one point I always like to try to make, that if you're looking at another organization down the street that doesn't have NextGen, just ask them if their providers have a direct message account, or does the clinic have a direct message account? And that will allow you to map that address here appropriately. But once you identify your providers that you refer to on a continuous basis, you can save them as a favorite here. So I have Carl Sutton here, I have Maria Vessel, and she's urology, and that's the provider I want to send my referral to. So I'm going to tap on Maria here, she automatically populates, and then I can come into my diagnosis here, and I can go ahead and attach up to 4 diagnosis codes. So I can say calculus of the kidney, dysuria, again, allowing me that ability to attach those diagnoses. And if I needed to, I could add a common assessment directly from here as well. My services requested, I want you to evaluate and treat my patient. And then I can put any type of clinical notes here in my pop-up list, so I can attach those, or I could go ahead and just type in kidney stone. And I could do the time limit. So I would like to see within 2 days. And then I could put any clinical information. About my patient. Now if I can type here. And then what's unique here, as I mentioned earlier, you do have the ability to attach documents from the patient's chart. So I can come under details, and I have up to 8 documents I can attach to the referral. So under the attachment 1, I can go ahead and say I want to create, attach my AFSO summary. I also want to do my master documentation. I can go ahead and document any images. I can pull anything onto here that would see fit to support this referral for the patient. And once I'm done with that, I can then come down here and I can provide specific instructions. I'm going to queue up that CCDA to be sent out. And then once that's completed, I can go ahead and tap on add. And then once it's add, I can send a note to my referral coordinators, and that will actually create a task that referral coordinator, and then they can go ahead and work the referral depending on your workflows within your organization. But it does allow me this prompt where I can send the task to the referral coordinator desk. And then I can go ahead, and then once everything has been processed or viewed, I can tap on share. So I've got my provider, I've got my diagnoses, I've attached my documents, I went ahead and populated everything under my referral ordered, and then as a result of that, I can tap on share, and this is going to send this referral electronically to Dr. Vessel to their direct message account directly out of NextGen with all the documents attached. Basically, like I mentioned, it's just like email. Now, for the sake of time, we do also have patient demographics here, and under patient demographics, we do have a feature called the PHI log. And the PHI log will allow me the ability to look at, anything that's sent for the patient and hasn't generated here yet. But I would be able to see, if something was generated, I could go ahead and look at that PHI log to see if in fact it was delivered. And here I can see a message was delivered to that Maria Vessel as a result of my referral. So I have that full understanding and that ability to track, when I send something out via referral through NG Share, I can see when that was delivered to the recipient. So again, give me that visibility in the system. And then one final component here I just want to show you. Let's flip this around a little bit. We talked about the CCDA, how we can pull in a transition to care document, review that. I talked a little bit about how I can bring in an op note through our interoperability platform or HMPs. I showed how we could generate a referral using direct trust accounts through the provider library. And now I want to just show you what it looks like if you receive an inbound referral. I'm going to pull up Beth here. So if I open up Beth, one thing I want to show real quick here is under clinical tasking. Now, this is really dependent on how you set this up within your organization. I do have the ability to task the provider that's named in the referral, but I also have the ability to task other staff members like your referral coordinator desk. So again, this is a configuration that you can set up. But now if I go ahead and I look at the task, it says a new document was received on this specific date from Dr. Acevedo at the practice. So I can review everything that came along with that referral and everybody that was also attached to that referral here. I can see the date it was received. I can see exactly what was submitted as part of that referral. There's their CCDA. I can also look at the supported a document attachment of an X-ray report, an APSO summary, an X-ray of the knee. So again, it gives me everything that's coming across based on that referral. A provider can also see those referral generation information directly in the PAQ if this is something that you want to route to the provider. I get a lot of organizations that say, my providers don't want to look at that, just route it to the referral coordinators and they'll handle it from there. Perfect. If you need to shut that off on the providers, you can contact NextGen and you can shut that off on the provider. So it's only going to the referral coordinators. But again, we give you that visibility within the system. Now, if I come into the chart, if I open up the patient's chart now, you can see that we do create a category based on that electronic referral. And here's my transition of care. So if you take a look at the documents that came in from another NextGen organization or maybe a third-party ambulatory EHR or an acute EHR, I can see all the documents that were processed over electronically. So here's a cover letter. Here would be a master document for the patient. So I can see all that information directly through here. So I can review, I can look at any diagnostic imagery that they attach to the referral, just like an attachment in an email. I could also look at a radiology report to substantiate the need for the referral, as well as a continuity of care document. So here's the CCDA from that practice doing the referral into the organization, another organization where that CCDA can be generated. And therefore, I can basically look at all the information that existed in that patient's chart and that provider's office. And now I have an opportunity to review it. And then I can reconcile it into my patient's charts, being that it's a brand new patient into my practice because they're being referred into. I can go ahead and use this information as my starting point. So again, giving me that flexibility in the system. So again, 3 different components I wanted to cover today. It's just giving you the visibility to the data share component. This is allowing us on a nightly basis to go out, reach out through care quality to the national health information exchanges, as well as point to point to the local information exchanges, and then identifying a document and pulling that down into NextGen so it can be reviewed and reconciled into patient workflow. And then we wanted to look at, how can we send out a referral for a patient? How does that referral get generated if you want to use NextGen Share? Again, giving me the ability to go ahead and use the referral template called NextGen Share through the assessment and plan, and then allowing me to create that electronic referral. Again, the same aptitude of creating an email, we can support it through this mechanism as well. And then we support the ability to track when those referrals are delivered and received within the system through the patient demographic PHI log. And then when inbound referrals are sent into the system from a third-party EHR into your practice, we do have the ability to monitor those. Tasks can be created from those referrals. We can load the provider approval work queue with those types of referrals. Again, giving us that capability within the system. So at this point in time, I know we have a few minutes left. I just want to open it up. Wendy, do we have any questions that came across as a byproduct of our overview today?
Yes, Earl, we do have one question, and this is a current customer who will be going live on NextGen in June. So welcome to the NextGen family. They are looking for a way to be able to track their referrals. How does that work in the system? Their current EMR has a tracking system for patients. Can we do that through orders management, or is that PHI log the best way to accomplish that?
We can do a report. I might have a report somewhere I can share with Wendy that we can share with you. But we do have the ability to report on. Are you talking about? Let me just clarify this: inbound referrals or outbound referrals, or both?
When a patient has a referral, we were able to update the status of the referral, such as booked, patient rescheduled, patient kept, appointment. Yeah.
So what we have in the system is that we have a feature called order management. So if it's an outbound referral, let me go ahead and go back to Pedro here.
While you're looking that up, there was also a question about, does this feature an additional charge? NextGen Share is free. Okay, let me just say that again. NextGen Share is free. There's no charge to use this service. There could potentially be a little bit of services fee to get it set up, but although we do have customers that do set this up and do it on their own, but if you did need some help getting it configured for your organization, you potentially would have to pay for that. So this is, I have a hard time understanding why customers don't use this more often, because it is a free service. And it really has a lot of powerful, as you've seen how easily Earl laid this out, the workflow. So go ahead, Earl.
Yeah, so when I'm sending an outbound referral, remember when I initiated that referral, that a window opened up that allowed me to task the referral coordinators. So by doing so, I can create a task for those referral coordinators that will show up here. And basically that calls out to them that, our patient has now been referred to a urologist. And then again, it basically follows through your workflow. So they will see that task, they will open up that task, and they'll come into an area in NextGen called order management. And here's that referral order I created. So once I come into the referral order, I can go ahead and tap on that, and here you can see it by date. This is my demo patient. So here's the referral I created to date, and now this gives me the continuity of managing that referral. I can go ahead as the referral coordinator, the one in charge. I can open this up, and then I can see everything that was sent. I can see a CCDA was sent. I can see everything was delivered as expected to that provider. But now, am I responsible for delegating, to a staff member to get the authorization for that referral? Am I delegating to a staff member to get this scheduled based on the referral? So again, it gives you the ability to track this type of information. If it was performed, I can also, if I obtain this myself, I can go ahead and add that. But if it was scheduled, I can go ahead and say it was performed. I can say the appointment date is, the 20th. The hour is, for example, 3 p.m. So I can document and the location, and this will be a value that you enter in the system. So I can go ahead and input this information. and then I can save and close this. But if I want a task, all I have to do is just hit task, obtain, for example, obtain a referral. I'm sorry, not obtain a referral. So for example, obtain authorization. And I can go ahead and save that. And then what's nice about that is that I can go ahead and attach the template that I'm on right now, the orders management template, and then I can delegate this to somebody. Here's that recipient, task recipient list. So who do I want to attach this to? Well, Andy Zabinski is responsible for getting authorizations and of course scheduling at the provider's office. So I can go ahead and task all of this to Andy, and then I can go ahead and save and close this. And then what's nice about that is when Andy looks in their inbox, if I come over to Andy's inbox here, there's that task that I just sent to Andy to get an authorization. And all he has to do is just double click here, and it's going to bring him directly into that template set. So again, now I can move directly over into orders management, and then I could go ahead and document the authorization number. However, we also have this little component here called manage selected order. So if I select this, the order I created for the referral today, I could tap on that, and then I could go ahead and attach statuses to that. So this is part of your workflow. So I can go ahead and say complete. I can say, authorization or appointment was kept, or for example, under obtained, I can have different actions selected here, but I could go ahead and just attach my different workflows here based on what I'm using to perform for this patient referral. So was the authorization captured? Was it completed, or was a request going through? So they can create a log under order statuses and details based on their actions that are assigned to those individuals. So anyone that's monitoring this referral can see exactly where in the workflow process the patient is based on the authorization or getting the appointment scheduled. They've left a message with the patient and so forth. You'll be able to see all the different users that are interacting with this patient referral to make sure that it's managed in a timely basis. So again, that gives you that ability. And then finally, we do have the ability to create a referral letter through this workflow. So in orders management, this would be an example of the referral letter that I can generate. And then I can go ahead and just send it out through NG Share again if I choose to do so. So there's the referral letter. And then we also have the ability to create a referral document for the patient. So if I wanted to create that today, I could certainly do that. And that would include, the location of the provider. There's the authorization number. Here's the ordering. So again, it gives you that information. Here's the appointment time frame. I can see all that information that was captured as part of that referral, what was sent over to them. And here is, the confirmed appointment information. So again, you have that mechanism to create that through this order management workflow as well. So that was a long story for a short question, but this is how we can manage it within the system. And it is truly related to your workflows. So our implementation team will certainly look at your workflows today and apply the functionality to your workflows for managing these types of referrals.
If we have time, Earl, a few more questions.
Sure.
So there was a question about how do they receive or go about getting or adding op reports in radiology?
So that would be something that is part of this platform as well. So that would just basically be as we set this up, we want to make sure that we can also incorporate other documents such as an op report, an H&P discharge summaries, and so forth, as part of the interoperability connections. So we automatically look for the CCDA, that transition to care document, but if we want to open it up to other types of documents and reports, it just has to be a dialogue that we'll set up for you as part of this interoperability. So if an organization has the documentation, we want to make sure that we're looking for it, and then we can pull it down into our system. So that's just a configuration conversation within NextGen.
Okay. So I did post a link at the top of the chat to where these Lunch and Learn series are. The recordings will not show up until the actual Lunch and Learn series has occurred. So you won't see, we just started this series today, so you won't see any recordings until we get them passed over to marketing and they have them posted. So as we go through, you'll just need to check back. But that site does also give you the ability to register for additional lunch and learn. So if there's other topics, you can see all the topics. You can see those there.
And Wendy,
Yeah,
can I just bring up one other thing? I know we're
sure.
a little bit over time.
That's okay.
This is called the Clinical Message Manager, and the only reason why I bring this up is this is very important, because if you're going to receive inbound referrals into your organization, if by chance the provider didn't exist or the patient didn't exist where we can actually attach it to the patient, that patient's going to automatically attach into the Clinical Message Manager. So here I can see it failed coming in because I have no demographics really that reflect the patient that it's attached to those documents. So this is just a little work cue that if I have to match this patient to a provider or match the patient to a demographic, what's nice about this is that I can go ahead and search the NextGen Master Patient Index, and if the patient doesn't exist yet, I can go ahead and build out that patient and then match all the documents to that patient. So it's a nice little protocol that NextGen has in your back pocket where, hey, the patient doesn't exist in my clinic yet, so I'm going to build out that patient and attach all these electronic documents to the patient. Or the provider on the referral cover letter doesn't exist, you know, I need to get that provider mapped as well. So it just gives you that ability to say, hey, if I get some referrals in and we know the patient has never been seen before, what do we do with that referral because it's electronic? And this is where it's going to queue up under the Clinic Message Manager, where you can do your appropriate mappings to get that patient's documents in their chart in the EHR. So I just wanted to bring this to your attention as well.
Yeah, there's some more questions that were in the chat. So where in the system do they add additional providers? The only place to add new external providers is using NextGen Share website. Is that correct?
Correct. So in NextGen Share, they have to belong to a health information service provider or be granted one through an account. So again, if you have providers that work at the hospitals, typically they're going to be enrolled into a HIS. You may have a provider down the street that, like, for example, Athena Health, they're going to be enrolled in a HIS. But if you have Jerry Martin, who's just a standalone provider practice that he uses, older software and so forth, he may not belong to a HISP. So if you want to exchange referrals electronically versus faxing, you could ask Jerry to reach out and join one of the national HISPs or local HISPs that participate with NG Share. And then they could create their own account that way, and therefore you'd have the ability to send electronic information back and forth. You don't build the providers in NextGen. Those direct message accounts are provided to us through NG Share and national and federated HISPs within the United States. So again, you have that capability.
Yeah, there was a question about one of the customers here says they're trying to use NextGen Share, but when calling specialists to get email information, they don't have a specific email set up for NextGen Share.
Well, what we need to ask the customer is, do they have a direct message account?
Right. Okay.
And not an email account, because that could be confusing. So, and they don't understand what NextGen Share is because that's a product of NextGen. That's what we just call it. So if you reach out to that customer again, ask them if their providers or their organization has a direct message account.
Right.
Or ask for the provider's MPI number to see if you can do a query of the MPI number through the direct share directory. So again, sometimes it's a vernacular thing. Sometimes I've heard customers call and they just don't understand what you're talking about. And basically, if you just say, "Do you have a direct message account?" That might be it.
Right. Right. Somebody said they need the link to be resent. Let me get that link again. Okay, I just sent the link. It should have gone to everyone in chat, so make sure you can see that. If you don't see the link, just go to Success Community and type in FQHC Lunch and Learn, and it will bring you to that page. It's just, so it's there. There's some other questions, Earl. There was a question. I'll cover this real quickly. I know we're over time, but this seems to be important for everyone. So as long as you're willing to stay on, we'll help you out. I think it looks like somebody's using a Crystal report to help track this information from orders management? Do you know anything about that? Cynthia said we use Crystal Report that pulls from order management. Our program staff update the status of the referral using the status and action comment fields. So it sounds like there is a Crystal Report that you'll be able to pull, because someone was asking about how would they report on what referrals they have currently open. So there is a Crystal Report in NextGen for that.
Let's just see if I can find it. I'll have to look at that because all I have is the INF report that's from the therapy area.
Okay.
Referrals. But let me get into that. We can share that with the group.
All right. Well, I think, let me get down here to the bottom. Tiffany said we also use Crystal Report for the open order report as long as they update the status. Cynthia said they had to build it, so it may be a specific Crystal Report that you may have to build. But that is an option to be able to build that. So if you need a further assistance or information on how to do that, or just understanding that, certainly reach out to your account team. They could put you in touch with someone who perhaps could help you get that done, because certainly doing the referral and tracking that is as important as getting the referral out the door, but tracking and make sure you close that loop as well. So we understand that. So I think Crystal Reports would help you there. So I think that's a good bit of the questions we've answered today. You guys have been a great audience. Again, this will be posted in Success Community. If you have other suggestions for other things we might cover for FQHCs, please reach out to your account team and let them know. We're going to do sliding scales. We're going to do NextPen. We're going to do some reporting. Let me see what else is on the list here. Quality measures. We're going to have one May 23rd on the dental record. If anybody is interested in their electronic dental record being integrated with NextGen, we're going to do population health. So some great topics coming up, but certainly open to continuing this series for more subjects should you have any. So again, I'll thank you for your time today, and follow up on the recording and follow up with your account team if you have any additional questions. And thank you so much. And we appreciate you guys being NextGen customers. Have a great day.
Thanks, everybody. Have a great day. Bye-bye.